Robert sat in my office 3 years ago, holding a lab report like it was a death sentence. His creatinine had just hit 2.1. His doctor had mentioned the word dialysis for the first time. Robert is a 67-year-old retired engineer, a man who had spent his whole life solving problems. But sitting in that chair, he looked like someone who had run out of solutions. I remember what he said to me. "Doc, is there anything I can actually do? Or am I just waiting?" That question changed our conversation, because the answer, as it turns out, was yes. There was something he could do. And 3 years later, Robert's creatinine is 1.4. Let me tell you how we got there. I am Dr. Maria Gulden. For 25 years, I have worked with patients managing chronic conditions: heart disease, diabetes, high blood pressure. And along the way, I have learned something important. The kidney is often the quiet victim of these conditions. It does not complain until it is too late. That is why I started paying close attention to creatinine numbers years ago, not just as a marker, but as a warning signal. Here is what I want you to know today. If your creatinine is elevated, you are not powerless. If your doctor has mentioned early kidney disease, you are not destined for dialysis. There are real, practical steps you can take. And that is exactly what I am going to share with you in this video. Before we dive in, let me give you a quick map of where we are going. First, I will explain what creatinine actually is, not in complicated medical terms, but in a way that makes sense. Second, I will walk you through the stages of kidney disease, because knowing where you stand changes everything about what you should do next. Third, and this is the part most people are waiting for, I will share the practical steps that helped Robert and many others bring their numbers down. And finally, I will be very clear about the warning signs: when to see a doctor, when to be concerned, when to act immediately. Now, let me be upfront about something. If you are already in stage 4 or 5 kidney disease, this video will still be helpful. But if you are already on dialysis or close to it, your situation needs a nephrologist. That is, a kidney specialist. Someone who can look at your specific case. What I am sharing today is most powerful for those in the earlier stages. Stage 1, Stage 2, even Stage 3. For those who have just gotten a high creatinine reading and are wondering what it means. For those whose doctors have said, "Let us keep an eye on this." For those who want to do everything they can before the situation gets worse. If that sounds like you, you are in the right place. Let us start with the basics. So, what exactly is creatinine? Let me use an analogy that I think makes this click. Imagine your body is a house. Every day you cook, you clean, you live in that house. And every day you produce garbage. Creatinine is garbage. Specifically, it is waste produced by your muscles as they do their normal work. Every time you move, walk, even breathe, your muscles create a little bit of creatinine. Now, in a healthy house, the garbage truck comes every day. It picks up the waste and takes it away. Your kidneys are that garbage truck. Here is the problem. If the garbage truck breaks down, or slows down, or only comes twice a week instead of every day, what happens? Garbage piles up. That is exactly what happens when your kidneys are not working at full capacity. Creatinine builds up in your blood, and when we measure your creatinine level, we are essentially checking how much garbage has piled up. The higher the number, the more backup there is. I know it is not the most glamorous analogy, but hey, medicine is not always glamorous. It is honest. Now, here are the normal ranges, roughly speaking. For men, anywhere from 0.6 to 1.2 milligrams per deciliter is considered normal. For women, it is slightly lower, up to about 1.1. But here is something important to understand. These numbers are not absolute. A large, muscular man might naturally have higher creatinine than a small woman. Someone who just did intense exercise might have a temporary spike. Someone who is dehydrated might show an elevated reading. One high reading does not mean your kidneys are failing. But consistently high readings, or readings that keep climbing, that tells us the garbage trucks are falling behind. And that is when we need to pay attention. Now let us talk about the stages of kidney disease. This is where a lot of people get scared. They hear kidney disease and immediately think of dialysis machines and hospital visits. But here is the reality. Kidney disease is not an on-off switch. It is a spectrum, and where you are on that spectrum makes all the difference in the world. Think of it like a dimmer switch for a light. Stage 1. The light is still bright. Your kidneys are working at 90% or better. There might be some early signs in your urine, some protein showing up, but functionally, you are doing well. Stage 2. The light dims a little. 60 to 89% function. This is where many people first notice something is off. Creatinine starts creeping up. Stage 3. Now we are in the middle range, 30 to 59% function. This is moderate kidney disease. Your body is starting to show signs. You need to be proactive here. Stage 4. The light is getting dim. 15 to 29%. This is severe. You need a specialist. Dialysis might be on the horizon if things do not change. Stage 5. The light is almost out, below 15%. This is end stage. Dialysis or transplant becomes necessary. Here is what I want you to understand. The journey from stage 1 to stage 5 is not a fast train. For most people, it takes years, sometimes decades. And at every stage, there are things you can do to slow down, stop, or even partially reverse the decline. Robert, the man I mentioned at the beginning, he was at stage 2 when we first met. 3 years later, he is still at stage 2. His numbers actually improved. That is not magic. That is strategy. And then there is Patricia. Patricia is 72. She was diagnosed at stage 2 8 years ago. I still see her every 6 months. Her creatinine has barely moved. She gardens, she travels, she spoils her grandchildren. Last month, she told me something I will never forget. Dr. Gulden, I used to wake up every morning afraid to check my numbers. Now, I just wake up and live my life. That is the goal. Not perfection, not reversing time. Just holding your ground and living well. And that is a victory worth celebrating. Let me tell you more about Robert, because his story might sound familiar. When he first came to see me, he was frustrated, confused, a little angry, honestly. He had done everything right, or so he thought. He had lost weight when his doctor told him to. He was taking his blood pressure medication. He had even cut back on the steaks he loved so much. And let me tell you, for Robert, giving up his Sunday steak was a big deal. His wife still teases him about it. And yet, his creatinine kept going up. 2 years before, it was 1.4, then 1.7, then 1.9, and now 2.1. It feels like I am losing a battle I do not understand, he told me. So we sat down and looked at everything. Not just the obvious things, but the small things people often miss. First, we looked at his water intake. Robert was drinking maybe 4 glasses a day. He did not like getting up at night to use the bathroom, so he had been limiting fluids after 6 p.m. That was a problem. His kidneys were essentially working on a drought. Second, we looked at his medications. Robert had been taking Ibuprofen almost daily for his knee pain. Over the counter, nothing special, he thought. But here is what many people do not realize. Pain relievers like Ibuprofen, Naproxen, even aspirin in high doses, can damage your kidneys over time, slowly, silently, without you ever noticing until the blood work comes back. Robert had been poisoning his kidneys with something he bought at the grocery store. Third, we looked at his stress and sleep. Robert was getting maybe 5 hours a night. He was worried about his daughter's business, his own health, the state of the world. His body was in constant fight-or-flight mode. Stress raises blood pressure. Poor sleep does too. And high blood pressure, sustained over time, wears down the tiny filters in your kidneys. So we made a plan. More water. No more daily ibuprofen. Better sleep habits. And we added some specific kidney protective elements that I will share with you shortly. 6 months later, Robert's creatinine was 1.8. A year later, 1.6. Today, 3 years in, it sits at 1.4. He tells me, "I wish someone had explained this to me earlier." That is why I am making this video. Now, let us get to the practical part. What can you actually do? I'm going to give you 7 strategies. These are not magic pills. They are not overnight solutions, but they work. I have seen them work in patient after patient. Strategy 1. Hydration. Your kidneys need water to flush out waste. Think of it this way. You cannot clean a house without water. You cannot wash dishes, mop floors, or do laundry without it. The same is true for your kidneys. Aim for 8 to 12 glasses of water per day. Not soda, not coffee. Water. If your urine is dark yellow, you are not drinking enough. Light yellow, almost clear, that is what we want. I know, more bathroom trips. But trust me, your kidneys will thank you. One exception. If you are already in late-stage kidney disease and your doctor has restricted your fluids, follow their guidance. This advice is for early stages. Strategy 2. Watch the pain relievers. This is so important, I need to say it again. Over-the-counter pain relievers can damage your kidneys. Ibuprofen, Naproxen, aspirin in high doses, even some prescription pain medications. If you have a headache, try a cold compress first. If you have chronic pain, talk to your doctor about kidney-safe alternatives. Do not take these medications daily unless absolutely necessary and supervised by a physician. I have seen too many people end up on dialysis because of something they thought was harmless. Strategy 3. Control blood pressure. High blood pressure is one of the top killers of kidneys. When your blood pressure is elevated, it puts constant stress on those tiny filters in your kidneys. Over time, they wear out. If you have high blood pressure, take your medication as prescribed. Do not skip doses because you feel fine. High blood pressure is called the silent killer for a reason. Strategy 4. Manage blood sugar. Diabetes is the other major kidney killer. High blood sugar damages the small blood vessels in your kidneys. If you have diabetes, keeping your blood sugar controlled is one of the best things you can do for your kidneys. Take your medications. Follow your diet. Check your numbers. Strategy 5. Moderate exercise. Exercise is good for your kidneys, but extreme exercise can temporarily raise creatinine by breaking down muscle tissue. What do I recommend? Walking, swimming, light cycling, stretching, yoga. 30 minutes a day, 5 days a week. Nothing extreme. Nothing that leaves you completely exhausted. Think of it as maintenance, not marathon training. Strategy 6. Sleep. This one surprises people. But sleep is when your body repairs itself, including your kidneys. Aim for 7 to 8 hours per night. If you have sleep apnea, get it treated. Poor sleep raises blood pressure and stresses your entire system. Robert told me that improving his sleep was one of the hardest changes he made, but also one of the most impactful. He went from 5 hours to 7. It took months to adjust. But his numbers showed the difference. Strategy 7. Diet adjustments. If you have kidney disease, you may need to adjust your protein intake. High-protein diets make your kidneys work harder. This does not mean no protein. It means moderate protein, and a shift toward plant-based proteins when possible. Your doctor or a nutritionist can give you specific guidance based on your stage. Also, watch your salt. High sodium raises blood pressure and makes your kidneys work harder. Cut back on processed foods, canned soups, and fast food. Now, let me talk briefly about the medical side. There are certain medications that can help protect your kidneys. 2 types in particular have good evidence behind them. The first type is called ACE inhibitors. Names like captopril, enalapril, lisinopril. These are often used for blood pressure, but they also reduce protein leaking into the urine and protect kidney function. The second type is ARBs, which stands for angiotensin receptor blockers. Names like losartan, valsartan, telmisartan. Similar benefits. If you have elevated creatinine and high blood pressure, your doctor might prescribe one of these. They are doing double duty, helping your blood pressure and protecting your kidneys. But here is the important thing. I am not your doctor. I do not know your specific situation. These medications have to be monitored carefully. Your kidney function, your potassium levels, everything needs to be checked. So please, do not walk into your doctor's office demanding a specific medication because you saw it on YouTube. Instead, have a conversation. Ask questions. Say, I heard that ACE inhibitors might help protect kidney function. Is that something we should consider in my case? That is how you advocate for yourself while respecting the expertise of your healthcare team. And if your kidney disease is more advanced, stage 3 or beyond, please see a nephrologist. A kidney specialist can offer treatments and monitoring that general practitioners simply cannot provide. Before I close, I need to talk about warning signs. Times when you should not wait. If you experience any of the following, please see a doctor promptly. Significant decrease in urination. If you are barely urinating or not urinating at all, that is an emergency. Your kidneys may be shutting down. Severe swelling. Swelling in your legs, ankles, feet, or around your eyes can indicate fluid buildup because your kidneys are not filtering properly. Persistent nausea or vomiting. When waste builds up in your blood, it can make you feel sick. Confusion or difficulty concentrating. Toxin buildup can affect your brain. Extreme fatigue. More than just being tired, feeling completely drained. Shortness of breath, especially when lying down. Fluid can accumulate in your lungs. Chest pain. Sometimes kidney problems can affect your heart. If you experience any of these, do not wait. Do not try home remedies. Do not hope it will get better on its own. Go to an emergency room or call your doctor immediately. For everyone else, here is my general guidance. Get your kidney function checked at least once a year. A simple blood test. A simple urine test. If you have diabetes or high blood pressure, check more often, every 3 to 6 months. Know your numbers. Write them down. Track them over time. And please, please, please do not replace the advice of your personal physician with what you see on the internet, including my videos. I am here to educate and inform. Your doctor is there to treat and guide. We are on the same team. Your team. Let me bring this back to where we started. Robert, sitting in my office, holding that lab report, feeling like he was out of options. Today, Robert gardens every morning. He plays chess with his grandchildren every Sunday. He travels with his wife twice a year. And yes, he has earned back his occasional Sunday steak. His kidneys are not perfect. They probably never will be again. But they are stable. They are holding their ground. And most importantly, Robert is not living in fear anymore. He is living. That is what I want for you. Whether your creatinine is slightly elevated or significantly high, whether you are at stage 1 or stage 3, there is always something you can do. The steps I shared today, hydration, avoiding pain relievers, controlling blood pressure and blood sugar, moderate exercise, sleep, and diet, these are not complicated. They do not require expensive equipment or special programs. They require consistency. They require patience. And they require you to believe that your actions matter. Because they do. If this video helped you today, I would genuinely appreciate it if you hit the subscribe button below and tap that notification bell so you do not miss what is coming next. I create content like this every week, focused on practical ways to protect and improve your health. If you know someone who is worried about their kidney function, please share this video with them. Sometimes the right information at the right time can change someone's trajectory completely, and I would love to hear from you. Leave a comment below and tell me, did the garbage truck analogy help you understand creatinine better? Your feedback helps me make better videos for you. Thank you for spending this time with me. Take care of yourself, and take care of those kidneys. Next week, I will share the 5 foods that can secretly support your kidney health. You might be surprised by number 3. I will see you then.